The breakfast foods most likely to be driving your blood pressure up are not the ones you have been warned about. They are not bacon. They are not eggs. They are not butter or cheese or anything that has traditionally been presented as the villain in a heart-healthy diet. The foods doing the most damage to blood pressure in people over 60 are the ones that have been marketed for decades as healthy alternatives, the ones that carry labels saying heart healthy and low fat and part of a balanced diet, the ones people choose specifically because they are trying to do the right thing. Here is what makes this particularly important. Blood pressure is not uniform throughout the day, it follows a pattern, and that pattern for people over 60 with hypertension peaks sharply in the morning, in the exact window when breakfast is consumed. The morning is the highest risk period for cardiovascular events. Strokes and heart attacks cluster in the 2 to 3 hours after waking because of a natural physiological surge in blood pressure and clotting activity that occurs in everyone, but is significantly amplified in people with existing hypertension. What you eat in that window either works with your cardiovascular system during its most vulnerable hours, or it works directly against it. For millions of people following what they genuinely believe is a blood pressure-friendly breakfast routine, the evidence now tells a very different story, and understanding that story could be one of the most valuable things you do for your cardiovascular health this year. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years in the A&E, I have seen what happens when blood pressure is not managed properly. I have seen strokes arrive in the morning, heart attacks that began over breakfast, hypertensive crises in people who believed their diet was protecting them. And what I have learned from those cases is that the gap between what people believe they are eating and what those foods are actually doing inside their bodies can be enormous. My goal now is to close that gap with honesty, with evidence, and without the food industry agenda that has shaped public health advice for the past 40 years. If you have high blood pressure or are over 60 and concerned about your cardiovascular health, I want to make you a promise. I promise to give you the clearest, most clinically grounded explanation of this topic that I can. All I ask is that you give this channel a fair chance and subscribe. If this video does not genuinely change how you think about breakfast, unsubscribe, no hard feelings. But give me your attention and let us continue. Before we get to the 5 foods, we need to understand something about blood pressure that most people with hypertension have never been told, because the timing of when blood pressure rises tells us something critical about why breakfast matters more than any other meal of the day. Your blood pressure is not a fixed number. It changes constantly throughout a 24-hour cycle, following a pattern that is so consistent it has a name: the circadian blood pressure rhythm. During deep sleep, blood pressure drops, ideally by 10 to 20% below daytime levels, in what cardiologists call the nocturnal dip. As your body prepares to wake, this changes dramatically. In the hour before and after waking, a surge of cortisol and adrenaline from the adrenal glands triggers a rapid, substantial rise in blood pressure and heart rate. This is the morning surge, a physiological mechanism that prepares the cardiovascular system for the demands of an upright, active day. In people with normal blood pressure, this surge is well managed. The vessels dilate appropriately, the body handles the transition smoothly, and blood pressure settles into a safe daytime range relatively quickly. In people over 60 with hypertension, this morning surge is exaggerated and prolonged. Research published in the Journal of the American Heart Association has consistently shown that the magnitude of the morning blood pressure surge is directly associated with risk of stroke, myocardial infarction, and cardiovascular death, independently of average 24-hour blood pressure. In practical terms, what your blood pressure does in the first 2 hours of the morning is a more important predictor of cardiovascular events than your average reading across the rest of the day. This is the window in which breakfast occurs. Now, to understand why certain breakfast foods are particularly damaging in this window, we need to revisit the 2 fundamental mechanisms that drive blood pressure up. The first mechanism is volume-driven. Sodium causes water to be retained in the bloodstream, which expands blood volume, which increases the pressure inside the arterial system. This is the mechanism everyone knows. It is why salt restriction has been the cornerstone of blood pressure dietary advice for 50 years. The second mechanism is hormonal. When you consume refined carbohydrates or sugar, blood glucose rises and the pancreas releases insulin. Insulin does not just manage blood sugar, it is also a sodium-retaining hormone. It signals the kidneys to hold on to sodium independent of how much salt you have eaten. The more insulin released, the more sodium is retained, the more water is pulled into circulation, and the higher blood pressure climbs. There is a third arm to this hormonal mechanism that involves fructose specifically. When fructose is metabolized almost entirely in the liver, it generates a byproduct called uric acid. Elevated uric acid impairs the function of the endothelium, which is the thin inner lining of every blood vessel in your body. Specifically, it reduces the endothelium's ability to produce nitric oxide, the compound that keeps arteries relaxed and flexible. When nitric oxide production falls, vascular resistance rises and blood pressure climbs through a completely separate route from sodium or insulin. Research published in Cell Metabolism has shown that fructose-driven uric acid elevation is one of the most consistent and reproducible drivers of endothelial dysfunction in clinical studies, and that its effects on blood pressure are independent of both sodium intake and caloric intake. Here is the key point. All three of these pathways, volume, insulin-driven sodium retention, and fructose-driven endothelial damage, can be triggered by a single breakfast, and they converge on the cardiovascular system precisely during the morning surge when blood pressure is already at its highest, most dangerous peak of the day. After 60, this problem is compounded by two additional physiological realities. First, insulin sensitivity naturally declines with age, meaning that for the same amount of carbohydrate consumed, older adults produce more insulin and sustain that elevation for longer than younger adults. Second, endothelial function is already reduced in most people over 60, meaning the starting point for nitric oxide production is lower, and the impact of any further impairment is proportionally greater. What becomes clear when you understand the system this way is that the breakfast foods most damaging to blood pressure after 60 are not primarily the salty ones. They are the sugary and refined carbohydrate ones, the ones that drive insulin up, trigger sodium retention, and damage the endothelium through the fructose uric acid pathway. And the majority of those foods are currently sitting in the heart-healthy category of breakfast choices. So let me name this explicitly because it needs to be stated directly. The mistake, and I want to be very clear, this is a systemic mistake, not a personal one, is that the heart-healthy label was built almost entirely on cholesterol data. Starting in the 1970s and accelerating through the 1980s and 1990s, dietary guidelines were shaped primarily by one question: does this food raise LDL cholesterol? If the answer was no, or if the food was low in saturated fat, it received a heart-healthy designation. The insulin connection, the fructose endothelial connection, and the morning blood pressure surge, none of these were part of the framework when these recommendations were built. The result is a generation of people with hypertension who have spent years making breakfast choices specifically to protect their hearts, and inadvertently triggering one of the most damaging blood pressure mechanisms in their body every single morning. This is not your fault. You followed the advice that was given. The advice was incomplete, and now the science has moved significantly beyond it. Here are the 5 specific foods that the evidence now identifies as particularly problematic for blood pressure in people over 60. Plain oats are a genuinely valuable food for blood pressure, high in beta-glucan fiber, which slows glucose absorption and supports healthy cholesterol. But the flavored instant varieties that dominate supermarket shelves are a different product almost entirely. A single sachet of a standard flavored instant oatmeal contains between 10 and 15 grams of added sugar, often as a combination of sucrose and high fructose corn syrup. The oats themselves are processed to a particle size that is absorbed extremely rapidly, producing a glucose spike nearly equivalent to white bread. The result is a significant insulin surge at the moment of highest morning blood pressure risk. People eating this every morning believing they are protecting their heart are, in metabolic terms, doing the opposite. Orange juice has been a breakfast institution for decades. It appears on hospital menu cards as a healthy option, but a 250 milliliter glass of orange juice contains approximately 25 grams of sugar, of which roughly half is fructose, with virtually no fiber to slow its absorption. It delivers a fructose load to the liver that is comparable in metabolic terms to a small sugary drink. Research published in the American Journal of Clinical Nutrition has shown that regular consumption of fruit juice, not fruit juice, is associated with elevated blood pressure and increased cardiovascular risk. The fiber that makes whole fruit metabolically safe has been removed. What remains is a concentrated fructose delivery system that hits the endothelium at its most vulnerable point of the day. Refined grain products are the most consumed breakfast food in the Western world, and for people with hypertension over 60, they represent the most consistent insulin trigger in the morning diet. White bread has a glycemic index comparable to table sugar. Bagels, despite their relatively neutral taste, contain enough rapidly digested starch to produce a glucose spike that sustains insulin elevation for 2 to 3 hours. Research published in Hypertension has demonstrated that high glycemic index diets are independently associated with elevated systolic blood pressure in adults over 55, with the effect size increasing with age. A typical serving of 2 rashers of bacon delivers approximately 800 milligrams of sodium, nearly half the daily recommended limit for people with hypertension, in a single breakfast component. Processed sausages and packaged deli meats are similarly dense in sodium. These foods also contain nitrates, preservative compounds that, in the context of an already inflamed cardiovascular system, have been associated in research published in the Journal of the American Heart Association with direct endothelial dysfunction and increased arterial stiffness. For people over 60 whose endothelial function is already reduced, this is a meaningful additional insult on top of an already compromised system. This is perhaps the most insidious food on this list because it is the one most deliberately positioned as a heart-healthy, weight-conscious breakfast choice. Low-fat or fat-free flavored yogurts routinely contain 15 to 25 grams of sugar per serving, added to replace the flavor and palatability lost by removing the fat. The fat removal itself is a problem for blood pressure because dietary fat slows glucose absorption and blunts the insulin response. A full-fat plain yogurt consumed with the same amount of carbohydrate produces a lower and slower insulin response than a low-fat sweetened yogurt. The low-fat product, despite its health positioning, consistently drives a larger insulin and blood pressure response during the morning window. Now I want to frame the solution section carefully, because this is not about restriction. It is not about eating an unpleasant, joyless breakfast in the name of health. What I am describing is a simple structural shift, from a breakfast built around refined carbohydrates and sugar to one built around protein, healthy fat, and fiber. That shift does not require exotic ingredients or complicated preparation, and the biological effects on morning blood pressure are, in some studies, measurable within days. I also want to be clear, if you are on blood pressure medication, none of what I am describing is a reason to change or reduce your medication without speaking to your doctor. These nutritional changes are most effective when they work alongside appropriate medical treatment, not as a replacement for it. Here is what the evidence supports as the most effective morning alternatives. Eggs produce almost no insulin response. They contain high-quality protein that supports the body's amino acid needs, including the production of nitric oxide precursors in the vascular lining. Research published in the Journal of Clinical Hypertension has shown that egg consumption is not associated with elevated blood pressure or increased cardiovascular risk in people with hypertension, contrary to what older guidance suggested. 2 to 3 eggs, scrambled, poached, or boiled, provide sustained satiety and a metabolically stable morning foundation without triggering the insulin sodium retention cycle. The key word here is plain. Full-fat plain Greek yogurt contains around 6 to 8 grams of natural sugar per serving from lactose, compared to the 15 to 25 grams in flavored versions. The fat content slows glucose absorption and blunts the insulin response. Greek yogurt is also a meaningful source of potassium, one of the most important nutrients for blood pressure management because potassium actively helps the kidneys excrete sodium and directly supports vascular wall relaxation. Adding a small portion of blueberries or strawberries provides additional potassium, anthocyanins, plant compounds with documented endothelial protective effects, and fiber without the concentrated fructose load of juice. Avocado is one of the most potassium-dense foods available. A single medium avocado contains around 700 milligrams of potassium. It is also high in monounsaturated fat, which supports endothelial function, and fiber, which slows glucose absorption significantly. The condition is that the bread matters enormously. A dense, genuinely whole grain or sourdough bread, one where you can see intact grain structure rather than just brown coloring, has a substantially lower glycemic response than standard whole wheat bread, which is often processed to a similar particle size as white bread. Research published in the American Journal of Clinical Nutrition has shown that high potassium diets are associated with measurably lower systolic blood pressure in people with hypertension. Alternative 4. Smoked salmon or sardines. This surprises people as a breakfast option, but it is one of the most cardiovascular protective morning choices available. Oily fish are rich in omega-3 fatty acids, which have well-documented effects on endothelial function, arterial flexibility, and blood pressure regulation. They produce essentially no insulin response. They contain meaningful potassium. And research published in the New England Journal of Medicine has confirmed the consistent association between regular oily fish consumption and reduced cardiovascular mortality. Smoked salmon alongside eggs or sardines on a small amount of whole grain toast replaces the processed meat sodium load with a fundamentally different cardiovascular profile. Alternative 5. The structural principle, protein before everything else. Beyond any specific food, the single most impactful structural change for morning blood pressure management is building breakfast around protein first. When protein is consumed at the start of a meal, it triggers the release of gut hormones, including GLP-1, that slow gastric emptying and significantly blunt the glucose and insulin response of any carbohydrates consumed alongside it. In practical terms, eating eggs before toast or Greek yogurt before fruit produces a measurably different insulin profile than eating those same foods in reverse order. This protein-first principle costs nothing, requires no dietary change, and can be implemented at any breakfast table immediately. Let me bring this back to clinical reality, because I think it adds something important to a conversation that can otherwise feel abstract. In emergency medicine, I have had patients come in with hypertensive crises, blood pressure elevated to dangerous levels requiring immediate intervention, who had taken their medication that morning exactly as prescribed. And when we talk through their morning routine, what frequently emerges is a breakfast that, to them, looked completely safe. Porridge made with flavored sachets, a glass of orange juice, toast with a banana, foods that every mainstream health message told them were appropriate choices for a person managing their blood pressure. The medication was doing its job, but the breakfast was actively working against it, driving insulin up, triggering sodium retention, impairing nitric oxide production, and hitting a body already at the peak of its morning blood pressure surge. This is not a fringe observation. Research published in the Journal of Clinical Endocrinology and Metabolism has shown that postprandial insulin elevation, the insulin response after eating, independently predicts blood pressure variability in people with hypertension over 60. How much your blood pressure fluctuates across the day is a cardiovascular risk factor in its own right. And breakfast composition is one of the most consistent determinants of that variability. The bigger picture here deserves to be stated clearly. The food industry spent 40 years shaping the definition of heart healthy around a single biomarker, LDL cholesterol, because it allowed them to reformulate products by removing fat and replacing it with sugar while retaining the health positioning. Low-fat yogurt, fruit juice marketed as one of your 5 a day, flavored instant oats with heart symbols on the packaging. These are products of a marketing era, not of nutritional science. The science has moved. The insulin-blood pressure connection is now well established. The fructose-uric acid endothelial pathway is documented across multiple high-quality research programs. The morning blood pressure surge and its relationship to breakfast composition is an active area of clinical investigation. What has not moved as quickly is the public guidance built on these findings. That lag is where the damage continues to occur, every morning in millions of kitchens, by people doing exactly what they were told. Understanding the two mechanisms, volume-driven and hormonal, means you no longer need to depend on a food label to evaluate a breakfast choice. You can ask two questions. Does this food contain significant sugar or refined carbohydrate that will spike insulin and trigger sodium retention? And does it contain protein, fiber, or fat to slow and buffer that response? Those two questions, applied consistently, give you more reliable guidance than any heart-healthy logo ever could. Blood pressure after 60 is not a fixed condition that medication manages while diet remains neutral. It is a dynamic system that responds to what you eat, when you eat it, and how those foods interact with the hormonal landscape of the aging body. Breakfast in that system is not the least important meal, it is the most consequential one. And finally, if you found this video genuinely useful, please subscribe to the channel and help more people like you find this information.